Assalamualaikum. Today we are going to discuss about microscopic lesions of the skin lesions. There are six types of microscopic lesion. Number 1 acanthosis, number 2 dyskeratosis, number 3 hyperkeratosis, number 4 papillomatosis, number 5 parakeratosis, number 6 spongiosis. Firstly, we discussed about acanthosis. Acanthosis is a thickening of the epidermis and elongation of the red ridges due to thickening of the spinous layer, enlargement of the red pages. Typical examples include chronic eczematous reactions. The main sign of acanthosis nigricans is dark, thick, velvety skin in body folds and creases. It often appears in the armpits, groin, and back of the neck. It develops slowly. The affected skin might be itchy, have an odor, and develop skin tags. As you can see in the picture, the differential diagnosis includes atopic dermatitis, Becker melanosis, candidiasis. The second one is dyskeratosis, abnormal premature keratinization within the cells below stratum granulosum. Additional findings in patients with dyskeratosis congenita may include short stature, eye and tooth abnormalities, thin and early graying of the hair, lung, pulmonary diseases, liver diseases, gut abnormalities, bone thinning, osteoporosis, infertility, learning difficulties, and delays in reaching developmental. The differential diagnoses include palmoplantar keratodermal spastic paralysis syndrome, nail patella syndrome, autosomal dominant nail dysplasia, poikiloderma. Number 3 is hyperkeratosis, thickening of the stratum corneum often associated with a qualitative abnormality of the keratin. Hyperkeratosis, dry skin, scaling, changes in skin color, localized hair loss. Differential diagnosis of hyperkeratosis, callus and cornus, keratosis plantar, chronic folliculitis. The next one is papillomatosis, surface elevation caused by hyperplasia and enlargement of contiguous dermal papilla. Multiple 1 to 5 mm, hyperpigmented early macules or papillomatous papules. These often form confluent patches or plaque centrally and a reticular pattern peripherally. Differential diagnoses to consider are acanthosis nigricans, tinea vascular, Dowling-Dego's disease, Galli-Galli disease, dyskeratosis congenita, prurigo pigmentosa. The next one is parakeratosis, retention of nuclei in the stratum corneum of squamous epithelium. On mucous membranes, parakeratosis is normal. Crusty lesions of the abdomen, distal portion of the legs, and medial thighs are characteristic of parakeratosis. The skin may be dry, rough, with dirt and debris accumulating in the lesions. In severe cases, reduced growth rate and appetite are seen, occasionally accompanied by vomiting and diarrhea. The clinical differential diagnosis includes seborrheic dermatitis, lichen planus, acanthosis nigricans, and gendodermatosis, spongiosis, intracellular edema of epidermis. Spongiosis is mainly intercellular edema, abnormal accumulation of fluid in the epidermis, and is characteristic of eczematous dermatitis and manifested clinically by intraepidermal vesicles, fluid containing spaces, juicy papules, and lichenification. The differential diagnosis includes atopic dermatitis, contact dermatitis, macular dermatitis, pityriasis rosa, seborrheic dermatitis. Thank you.